Welcome to Learn Medical Spanish. In this dialogue, I'll be going over an HPI, or history of the present illness, for a patient with a stroke, or a potential stroke, obviously, because you don't always know if it's a stroke, but that's what we're trying to figure out. So I'm going to say the phrases in English first, and then I'll say them in Spanish a couple times, so you get some practice thinking about the translation, but also repeating the phrase a couple times in Spanish. And FYI, this is similar to some content in my CME course as well, and there's a link to that in the podcast episode description on your app or on the YouTube video description as well. So here's the first phrase. Do you feel weak on one side of your body? ¿Se siente débil en un solo lado de su cuerpo? ¿Se siente débil en un solo lado de su cuerpo? So there's a little, if you're looking at the text on my website or on YouTube, there's a little, like a footnote symbol there next to the word you. And this is going to come up throughout this dialogue. So most of the time when I say you, it could also mean he or she. So you could be asking a family member about the patient, and the wording would be the same because we're using the usted form, which is the same verb form as he or she. So you can say you or he or she using the exact same words in this case. So here's what I mean. When you say se siente, you could say usted se siente, and that means do you feel? Or you could say él se siente, that means does he feel? Or ella se siente, does she feel? So we're leaving out the pronoun in Spanish because it's optional, but depending on the context, this could mean do you feel, does he feel, or does she feel? So you could be saying it directly to the patient, or you could be asking somebody else. So that's going to come up additional times. Basically, anytime I say something like, do you have this issue or whatever, it could also mean he or she. Does one side of your body feel numb? So that could also mean his or her body. Does one side of your body feel numb? Un solo lado de su cuerpo se siente entumecido. Un solo lado de su cuerpo se siente entumecido. Point to where. Señale dónde. Señale dónde. Face. Cara. Cara. Arm. Brazo. Brazo. Leg. Pierna. Pierna. So we're clarifying if different parts of the body are numb or weak, by going through those significant regions that we're asking about. Is it just one side? Is it just on one side or on both sides? ¿Solo en un lado o los dos lados? ¿Solo en un lado o los dos lados? So again, we're just clarifying or confirming to find out, is this really just on one arm or one leg or one side of the face? If it's not something we can objectively see, we're just asking the patient or the family member. Do you feel more confused than usual? And this is another important example of you could ask the family member, does he or she feel more confused than usual? And it's the same wording either way. ¿Se siente más confundido que lo normal? ¿Se siente más confundido que lo normal? And from time to time, there's an adjective that you might need to change the gender. Like confundido is masculine. So if it's a woman, you'd say confundida. Are you having trouble speaking? ¿Tiene problemas para hablar? ¿Tiene problemas para hablar? So once again, that could be asking the patient or someone else. Is this problem new? ¿Es nuevo este problema? ¿Es nuevo este problema? How many hours, as in how many hours since it started is what's implied. How many hours? ¿Cuántas horas? ¿Cuántas horas? I guess a slightly more clear way would be to say hace cuántas horas, as in how long has it been, and that might be a little easier to get the point across. Another way you could ask that would be, since what time? ¿Desde qué hora? ¿Desde qué hora? When did you last see him or her normal? ¿Cuándo vieron a él o ella normal por última vez? ¿Cuándo vieron a él o ella normal por última vez? Is it worse now? ¿Está peor ahora? ¿Está peor ahora? Better now? ¿Mejor ahora? ¿Mejor ahora? You could make that into a more complete sentence if you wanted to say it by itself. You could say está mejor ahora, just like we did with está peor ahora. Next phrase, still the same. Sigue igual. Sigue igual. So that's probably not the translation you came up with for still the same, but this is just a pretty good way to say, is this condition still the same? So sigue means like it continues to be. It continues to be the same. Sigue igual. Igual means the same, or sounds kind of like equal, right? Sigue igual. You could have said like todavía lo mismo, and that kind of gets the point across, but it's not as good as this phrase. Is it all the time? As in constant. Is it all the time? ¿Es todo el tiempo? ¿Es todo el tiempo? Does it come and go? ¿Va y viene? ¿Va y viene? Did you hit your head? Se golpeó la cabeza. Se golpeó la cabeza. When? Cuando? Cuando? So I have a bunch of other similar dialogues that you can find on the YouTube playlist on your screen if you're looking at YouTube, or if you're on the podcast, obviously there's a whole bunch of them there. And also there's a video there on that YouTube end screen that explains my CME course in detail. And as it mentions there's some links to other resources in the video description and the podcast episode description. Thanks for listening, and I'll see you next time on Learn Medical Spanish.